Gastrointestinal bleeding. Acute gastrointestinal bleeding is a potentially life-threatening abdominal emergency that remains a common cause of hospitalization. Upper gastrointestinal bleeding is defined as bleeding derived from a source proximal to the ligament of threads.
Hello, this is Dr. Carlo Ojet, emergency physician and founder of edxitvideo.com. This video is about gastrointestinal bleeding. The first thing we need to do is make the differentiation between upper gastrointestinal bleeding and lower gastrointestinal bleeding. If you're vomiting blood, that is called hematemesis. And hematemesis can be due to a Malloy-Weiss tear. If you want to learn more about that specifically, I have a video just on that. But it's usually a result of forceful vomiting that causes a tiny tear at the junction of the stomach and the esophagus. It's usually self-limited, and it heals itself.
The incidence of upper gastrointestinal bleeding is approximately 100 cases per 1,000 population per year. Bleeding from the upper gastrointestinal tract is approximately 4 times as common as bleeding from the lower gastrointestinal tract and is a major cause of morbidity and mortality. Mortality rates from upper gastrointestinal bleeding are 6 to 10% overall.
In digestion, food is changed by the organs into a soluble form to be absorbed by the body. Food in the mouth is mixed with saliva. Saliva begins to dissolve the food as the teeth grind and cut it. Food is forced back into the throat, pharynx, by the tongue. Food in the pharynx stimulates the swallowing reflex. The larynx is pulled upward to meet the epiglottis and seal off the trachea. Food goes from the pharynx to the esophagus. Food moves down the esophagus by peristalsis. The peristaltic wave reaches the esophageal sphincter and food enters the stomach. The unique muscular structure of the stomach breaks up the food into small pieces called chyme. Chyme exits through the pyloric sphincter into the duodenum.
The diagnosis of and therapy for non-varical upper gastrointestinal bleeding has evolved since the late 20th century from passive diagnostic esophageal gastroendoscopy, with medical therapy until surgical intervention was needed, to active intervention with endoscopic techniques followed by angiographic and surgical approach if endoscopic therapy fails.
Your doctor has recommended that you have an upper GI endoscopy. But what does that actually mean? An upper GI endoscopy is a diagnostic procedure used by your doctor to inspect the inside of your throat, esophagus, stomach, and upper intestine. While it's considered a surgical procedure, endoscopy does not involve an incision. Instead, your doctor will pass a flexible tube called an endoscope through your mouth and into your
Signs and symptoms: hematemesis, melena, hematochezia, syncope, presyncope, dyspepsia, epigastric pain, heartburn, diffuse abdominal pain, dysphagia, weight loss, jaundice.
This is Dr. Carlo Ojet, emergency physician and founder of edxitvideo.com. This video is about upper GI bleeding. Upper GI tract This includes your esophagus or swallowing tube, stomach, and part of the small intestine. The causes. Sometimes, even with testing, the cause of bleeding is not found. Most commonly, ulcer. This is when the mucous membranes.
Diagnosis: orthostatic blood pressure, complete blood count with differential hemoglobin levels, basic metabolic profile, blood urea, nitrogen and coagulation profile, calcium level, gastric level, endoscopy, chest radiography, nasogastric lab, angiography. Computed tomography scanning and ultrasonography may be identified for the evaluation of the following: liver disease with cirrhosis, cholecystitis with hemorrhage, pancreatitis with pseudocyst and hemorrhage, and
A CAT scan is a
aortoenteric
medical
fistula.
procedure in which a specialized X-ray provides a cross-sectional image of the body. A patient lies inside a tunnel equipped with a scanner. The scanner consists of an X-ray emitter 180 degrees across from the receiver.
Management: secure the airway, insert bilateral 16 gauge upper extremity peripheral intravenous lines, replace each millimeter of blood loss with 3 millimeters of crystalline fluid.
It's a big operation. Then your doctor tells you it's so risky you might not make it off.
In patients with severe coexisting medical illness, pulmonary artery catheter insertion of monitoring hemodynamic cardiac performance.
The table. That's what the man you're about to meet faced until doctors at Mayo Clinic tried a less invasive experimental procedure. The technology allows doctors to see and reach inside the body where they couldn't before.
Indication for surgical. In patients with bleeding peptic ulcer include the following: severe life-threatening hemorrhage not responsive to resuscitative effort, failure of medical therapy, endoscopic hemostasis with persistent current bleeding, Approach considerations. Primary surgical intervention should be considered in patients with a perforated viscous, in patients who are poor operative The goal of medical therapy in upper gastrointestinal bleeding is to correct shock and coagulation abnormalities and to stabilize the patient so that further evaluation and treatment can proceed. High doses may reduce the need for endoscopic therapy.
A peptic ulcer is a sore that develops in the lining of the lower part of your esophagus. or various parts of your stomach